Okay, then, I guess I'll call the Neighbors of Dunn County Committee meeting to order. Call the roll. I see all 5 committee members are here. Plus Carmen and Scott. First off, let's approval of the minutes. This time everybody has seen the minutes. Any questions? Changes? And I'll accept the motion to approve the minutes, please. Corley and Sean, first and second. All in favor? Aye. Okay. Minutes are approved. Is there any public comment? Carmen, nothing you've heard of? Okay. None of that. Next up. Oh, I first want to, before we go on to the yours, welcome, Larry. Good to have you back. And the other folks that were here last time, we had a long meeting, and I appreciate you sitting through the long meeting. That was really my fault because I asked for extra things in it. So it won't be as long usually each time. But today I'm going to ask for a couple other little explanations too as we go. But so thanks for sitting through that. And I didn't hear a single complaint. I think Carmen, you and everybody else did a great job. So let's go on to number 5 then, please. Carmen, you're on.
All right, thank you, Mr. Chair. As always, we will start with Quality Assurance Steering Committee updates. So we met last week for this meeting. It was a little bit shorter of a time frame because we had to move the meeting the month before. So we were only looking at 3 weeks instead of the normal 4. So it's a little bit shorter of a meeting. We talked about our COVID situations, which I'll get into a little bit later, but going through COVID outbreak and all of that ramping up again. So we discussed that during our Quality Assurance Steering Committee, as well as we talked about changing our restorative program, just the tracking of it. So not actually how we do it. Restorative is basically like therapy for ongoing long-term care residents. So it is a therapy program that the therapy department creates that the nursing staff then carries out. So if it's walking programs, so like Walk to Dine is a very traditional one where you walk from their room to the dining room, making sure people are getting exercise, range of motion, things like that. So we're just trying to vamp up our tracking of that, as well as having that in a different form on our medical record system. So we discussed that. That will help us for billing purposes. So Medicaid has changed their billing purpose or their billing structure in the last couple of months. So they're looking more at that. So it's even more important that we're catching all of those things that we're doing, because it will help increase our reimbursement for Medicaid residents. So any questions on quality assurance meeting?
I do
Sure.
on what you just said, to elaborate a little bit. So you said Medicare changed their billing last couple of months. I thought they changed it like 6 months ago and then 8 months ago. And then
So this one's Medicaid. So Medicaid changed their billing at the beginning of this year. And basically they changed it to match Medicare. So Medicare did PDPM, the patient-driven payment model. A couple of years ago. It's been a long transition period, basically. That started right before COVID started, was so 2 years ago now. And we changed that for Medicare, and then Medicaid followed this year. So basically, instead of having an averaged rate for everyone on Medicaid, it'll now be more reflective of what we do for those people. So capturing all of those things and documenting all those specific things like restorative programs will be more beneficial now, instead of having it be more of a generic rate.
Thank you.
Mm-hmm. Any other questions on quality assurance? All right, and then I'll turn it over to Chris for the employment activity report.
Good morning. Can everybody hear me?
Yes.
Okay. So in your packet, you would have gotten the employment activity report for April. Just kind of go through the types of recruitment, didn't change much. I did put a Facebook post or push out there recently, so that we could add that to that too. If we want to go down to number of interviews, we did about 9 interviews in the month of April. 2 positions were offered and neither of them were accepted. None were licensed nurses, so we didn't really have to go above that step 3. We had 5 resignations for the month of April. If you can see them listed on there. We did lose some homemakers that month, and we did have a full-time CNA retire after 30 years. We go down to open positions. Those have been tweaked, with the number of people coming and going. We go down to leaves of absences. It was 21 active leave of absence, with be it FMLA or educational or military, had a couple of them. For May, that should dip down with some of our students coming back. We go down to work comp lost hours. Again, for April, we had no work comp lost hours, which is always a good thing. And if we go down to number of missed shifts in April due to COVID issues, with calling in with symptoms, but testing negative, we still have to be off, that type of thing. It was 50 shifts, or roughly 450 hours, because, it's a mix of shift length from, 3, 10, 8, 12 hour shifts. Kind of an average out of what was missed was about 450 hours. And that includes agency staff that would have missed due to COVID related issues. Does anybody have any questions on the employment report?
Anyone? I have a question about the retirement after 30 years. I'm curious, was this person included, or will they be included as recognition as a county?
They
board
already
member?
were. Yeah,
Yep.
They were.
already-
They were
Okay.
at not last night's meeting, the meeting before.
Okay.
Yeah, Mr. Chairman,
Yeah, it's,
I have a question. I was wondering, I think a couple, 3 years ago, I heard that, and I don't know if it's true or not, but we lost people due to going other places for higher pay. Is that still a problem, or?
It is on and off a problem. So that was part of when we did the wage study through the county this past year. NDC actually has a separate wage grid now, and that's been to adjust to that problem. So we used to be embedded into the overall Dunn County wage grid, which made it a little bit more difficult when we were having increased need to increase versus other positions just due to the healthcare shortage. So now our wage grid is pulled out of it so we can adjust a little bit easier. So that was a step we took to address that issue with HR. So now we're not seeing that as much, but we're fighting wages all the time across the board. It's normally, it's a little bit more difficult to fight against the private sector because they don't go off of a grid kind of thing. They just throw out a number, and everybody needs people as much as we do. So when we have those questions come up, we then work with HR and Nick to offer a higher wage for somebody. So in the terms of leaving, if they tell us that they're leaving in advance due to pay, we normally try to work with the individual and adjust if we can.
can you also offer them other little perks, flexibility in one way or another?
So recently, I believe that was last month or maybe the month before, the county board approved us being able to offer extra vacation pay or vacation days. If the person's full-time, we can do that. Obviously, if someone's part-time, they don't get PTO kind of thing. But so that is one of the perks we can do. If it's coming to scheduling and stuff like that, we try our hardest to work with people. The one thing that we always hold firm to is the every other weekend though, just out of fairness. Because if we offered that to one person, I'm sure nobody would want to work weekends or holidays. So that's one that we struggle with sometimes, but making sure we keep it that everybody's working every other weekend is one of the ones we can't be super flexible with, that like a clinic would be able to because they're not open on weekends. But we try our hardest to work with people before they would go somewhere else.
Supervisor Breslin?
Has this homegrown CNA program had a movement in the last month?
So we still are working on it. I know it's a slow process, but it's a fairly lengthy application process, and we're currently working on it. One of the next steps is finding a trainer. So to get fully approved, we have to have a trainer on board. So we have to work with HR to then also have that as a position, because that's currently not a position in the county. So that's our next step at this point. And then finding a trainer after we get the position as well. We did speak with a nurse trainer that's actually at a different skilled nursing facility in the region that would be interested. So we are hopefully getting closer to that.
So thank you, Sean, for asking that question. So the trainer would be paid through the county, not through fees or whatever, tuition?
So it would be partially paid by tuition. If the tuition could cover all of it, that would be excellent. I don't know if that's going to be the case based on how much the classes normally cost and things like that. That would be the goal. The other thing that we have discussed is potentially having, so if we could find someone that would only work those hours and do just the CNA training program, we could probably have it fully covered by the fees. When we've talked to individuals, they're typically looking for more hours than just that. So if they wanted to work on the floor versus just doing that, or if we had them be more of a trainer that could also take on some of the training of our current staff, because that would also be helpful in retention too. So we're kind of looking at different ideas for that position of how to get a qualified applicant that wants more hours in the building kind of situation.
Now, as far as the students, the CNA students that would hopefully sign up, are there plans to give them a break on tuition or complete tuition free if they stay and work?
We haven't gotten that far yet. That would be an option that we could do. The class as of right now to us, well, it wouldn't be paid to us. We weren't charged it, but what it would cost us to have them go through without the cost of the teacher is $475. So that's the cost of the program if they were to come and use the Ready CNA program. So that would be charged out to the students. So if we did do it, if they stayed with us, that would be the cost per student. In addition would be the cost of the instructor. So $475 is just the class.
Sean, any?
I think it would be something that we should look at as, paying for the tuition if they stay a year,
Yep.
or that's what we do at my work for truck drivers now.
Yep. Yeah, it was
Working out
something.
really well.
Yeah, it's something we've talked about. We just haven't gotten that far yet. We're working on getting the teacher and getting approved and everything first before we go take that next step.
Anybody else?
Supervisor Wetzel, your types of recruitment, and maybe you mentioned this last month, but I don't remember, is the NeoGov? The Neo, so what's that about?
NeoGov is the county's HR platform. So basically it's where we do everything HR related for county things. So everyone that works at the county has a NeoGov login. It's where we do like our paperwork for like your I-9 and your HR paperwork kind of stuff, but it's also where we do our recruitment. So at the start of a recruiting, say our CNA, homemaker, and nurse positions are always just up there, but say we're recruiting for a position that's just a one-person position kind of thing. We put what's called a requisition out there. It gets approved by HR, finance, and the county manager. And then at that point, it generates the ad basically on there. And then that's linked on our county website. And then when an applicant wants to apply for a position, it brings them to that website and the application is on NeoGov.
Okay, thank you, everybody.
All right, thanks, Chris.
Yep.
Next is our resident referral report, which is also in your packet. This month, we started out the month with 98 residents. We had 104 referrals, so that's a little down from the past couple of months. but still quite significantly high compared to pre-pandemic. We had 19 residents admitted. So that number is up. That number is a little bit higher than normal because we were admitting more people, as well as just the in and outs of readmits. So at the beginning of the month at 98, we had a few people in the hospital. So the numbers they don't add exactly up because some of them are readmits versus a new admission. At the end of the month, we had 100 residents. We had one resident transfer to another facility that was closer to home. We had 3 deaths, and then we had 9 people discharge home. So as we are getting more Medicare residents, we'll continue to see that discharge number go up. That's actually a good thing, even though it means less residents in our facility. It means that we provided the care they needed and we were able to have them go home and back into the community. So even though it's people leaving our building, it's leaving for a good reason. Today, we have 104 residents, I believe. If we have a couple of people in the hospital right now. And then we currently are accepting admissions to the East Building. I'll get into it a little bit later, but due to COVID positive staff and in the West Building, COVID positive residents, we've not been able to admit to West or Central for a little while. So our number of admissions has gone down just because we only have one building to admit to, where most of the open rooms are in the memory care. So that's where we are currently at. And then our referral sources are the same as usual. We are still seeing referrals from kind of obscure locations as well, with people casting a wide net to find a place for people to go. But our majority of our referrals still come from Eau Claire or Menominee.
Any questions? Okay,
All right. And next is Scott's report for the environmental and facilities.
Good morning, everyone. So currently, I reported before that Brady had taken over at the neighbors as the maintenance specialist. He's doing a very good job over there. I have Bob is the facilities worker that is there. Both of them have been keeping up on work orders, keeping things repaired, keeping things moving. Managed to get out and mow the grass once so far, so we started that to try and keep ahead of it. Doing very good there. I've been working with Alyssa at the neighbors as far as getting some groups in, to volunteer groups to work on the flower beds, to get those back up into shape. I've got some young people that are looking for community service hours. So coordinating with staff of human services to get some volunteers in there also to do that, to fill their community service hours, work on some flower beds, get those cleaned up. Carmen and I had a budget meeting last week. We discussed looking into the possibilities of leasing on a bus. So I have a meeting today with leasing company, and they're checking into the possibilities of leasing a bus. If we could do that, that might be another option as far as getting hold of a new bus. So I'll have information on that next meeting. Otherwise, things are going pretty smooth. I think no major humps in the road. We're doing good. So any questions?
and the bus might be just temporary, or it could be if it worked out instead of a new one.
Yeah.
Okay. And can that be through Enterprise also?
That's what I'm checking with. I have a meeting with Enterprise. The downside on the bus, the information that I found out so far is that they're 12 months out on getting a new bus. So I will find out all the details and report
Okay.
back, but doesn't hurt to check out the possibilities.
Any questions? Yep,
Mr. Chair.
Supervisor Bjork.
Thank you. As far as the bus, the county buses that run now, that they already have, they're not available at a certain time when you might need to use a county bus, or are we talking about a different type of bus?
those buses that transit has have the routes and they're running continuous every day. The bus we're looking at is the one that is designated for the neighbors, that they take residents to outings.
Okay.
It's primarily used for an activities bus. So when we take residents to the band concert or to see the lights at Irvine Park or anything like that, we need a bus to transport them. The bus, we couldn't get enough wheelchairs on the transit buses, and they go in a certain route versus,
Yep.
so that where we might want to go might not be on the route.
So would other would other healthcare facilities also have the same need of a bus? And is there any linking up with anybody else to use? You know, I mean, can you call whoever and say, would your bus be available on such and such a day?
And that might be a possibility. So almost all nursing homes own a bus or a van of some sort to transport residents. In the summer, I'll be honest, ours is used every single day.
Oh,
So
okay.
I would
Mhm.
assume that most nursing homes are like that. We could ask ALH or Colfax would have one as well, but they are used pretty continuously.
And how close are we to getting a new bus?
Fundraising wise, we are now up to, I believe we're at 40% of the bus has been fundraised for, 40% of $90,000.
Okay,
Mhm.
thank you.
Thank you.
All
Good-
right.
Good questions. I hadn't thought of them. Well, take some time off. You get to think a little bit. Huh?
I've had a lot of time to think.
All right, next up is our COVID-19 update. So I've made reference to this a couple of times already. Last month, I reported that we were having some COVID positive cases in the West Building. I believe our meeting last month was the day after our first case, which actually was, we had 7 cases in our first day. So we had one resident that was showing symptoms, and we tested that resident. They were positive. The standard protocol is to then test every resident that they would have had contact with, which would typically be their household. So we tested that entire household. On that first day, we had 7 positives. Luckily, only the first person had any symptoms. The rest were all asymptomatic. And then within the next day, we had 2 more positives. And in total, within a week, we had 14 positive residents. Luckily, everybody, with the exception of 2 or 3, were completely asymptomatic. The individuals that did have some symptoms were extremely mild symptoms. The most extreme was a slight cough and feeling tired. So that was very fortunate, comparingly speaking to the last time we had a major COVID outbreak a year and a half ago, which was a much different situation. For the 14 residents, all of them have recovered from COVID. So we still do 10-day isolation for all residents. That is one thing that, as the rest of the world changed, healthcare did not. So we are not able to do the 5 days and then 5 days with a mask that anyone in general population would be able to. We do full 10-day isolations for both residents, staff, visitors. Everybody has to comply with that, just as the risk that is there for our vulnerable people that we serve. So all 14 of those residents have fully recovered from COVID and are doing okay. We are continuing to test in the households in the West Building, as we have had staff and additional people test positive, but just after that first week, we had no additional residents. So we were able to isolate it from what was found out from the original week, and then it has not spread to any other residents since. Knock on wood, as we're doing probably our last round of testing for that outbreak today, but hopefully those all come back negative and we can clear that outbreak with public health. In regards to that outbreak, we did have what's called an ICAR survey. So it's basically an infection control specific survey. It is non-regulatory, so they don't issue citations or anything like that, like the state or federal surveyors do, but it is triggered by CMS, our regulatory body. So it's considered, it sounds like a terrible term, but any nursing home that has 5 or more COVID cases is considered a COVID hotspot and is required to complete an ICAR survey with a state infection preventionist. So we had that actually on Tuesday of this week. Basically, they have a call with us. They go over our infection control policies, procedures, how we handled the outbreak, how we were preventing an outbreak from occurring, trying to kind of figure out why it occurred. We went through that very smoothly. They had no concerns with our infection control processes. We basically checked every box that they asked. So, and the person who we spoke with for that process said, this is what's happening. Everybody's doing what they should be doing, and things happen. We are open to visitors. Our residents are able to go to different places. They can go to their family homes. They can go out in the community. So we're not immune to having outbreaks, because even if we're following every possible procedure, they still occur. So we obviously don't want COVID-19 outbreaks and everything like that, but if it wasn't very significant in terms of effect on our residents afterwards. So we're very happy with that, comparatively speaking, to what could happen with that significant of an outbreak. Luckily, everybody is okay. Through that ICAR survey, we are also required to do a QA initiative that is in relation to infection control. So that's also part of the CMS mandate. If you are a COVID-19 hotspot, we are required to do some sort of project, basically, and run it through our QA committee. So ours, we are going to be doing on auditing of cleaning of shared items. And they didn't say this is why they think we had this outbreak. We explained to them that the residents in this household are friends, which is an awesome thing. They sit and play cards, they have coffee together. So if one of them was going to get COVID, most of them were going to get COVID, but they're living a happy life by having community with each other. So luckily, it didn't lead to any negative effects. But so we are doing auditing of shared materials. So things that we only have 1 or 2 of in a household that we have to share between residents have to be cleaned in between each resident. So we're going to be doing auditing of making sure that those are being properly cleaned, and then reporting that back to the state, which was approved as our QA process. So an example of that would be like a lift. So we have residents that require mechanical lifts to be transferred from, say, their bed to their wheelchair, or wheelchair to a different chair. And those are shared because we can't have one for each resident. They're very expensive machines and take up a lot of room. So making sure that those are cleaned properly from one resident to another. And we will have to report data on that for 6 weeks to the state. And then after that, we will be taken off of the COVID hotspot list if they approve it.
This sounds like a substitute teacher giving busy work for somebody for a while.
Yeah.
You have to pick your own assignment and then follow through with it for 6 weeks.
Yes.
Okay. And I want to, I'll leave it at that.
Okay. Yeah, I know if there was, they would probably give us a directed assignment if during that ICAR survey, they found something that we were doing wrong. Say we didn't do, so the questions related to everything infection control, including how do we screen people at the door? What kind of PPE are we using? What do we do in certain situations? If they had found that we were doing any of those things wrong, they probably would have said, this is your project. But because they didn't find anything that they could pinpoint as we were doing wrong, they said, pick a project, basically.
Okay, now that reminds me what I was going to say.
Sure.
Of the new members, well, you'll notice that every time that we have some kind of survey or someone comes in, we do amazingly well. I think Scott and Carmen combined It's fantastic how few things they find wrong. And as most of you probably know, if they don't find anything wrong, they have to make up something wrong. So just watch this as we go along here. They just do a great job.
Thank you.
Any more COVID?
Just that Central also had positives, no positive residents, just positive staff. So we are seeing, as the rest of the community is seeing, increase in COVID positivity. So we have had some positive staff. Just as a reminder, when that occurs, we then have to do a full outbreak, even though there's only one positive staff person. If they were in the facility at any point, either 2 days before their symptoms or positive tests, or say they didn't have symptoms, were asymptomatic and got tested because of routine testing, and then came up positive after the fact, they were probably in the building during the time. So then wherever they worked, we have to then do an outbreak, which means testing of all the residents, testing of any staff that they would have had in contact with, and then we cannot admit to that area for 14 days. So that's why right now Central is not being admitted to, even though we did open Fireside. We can't admit. We can readmit. So if we send somebody to the hospital, we can take them back because they were already exposed to that situation. They don't make us keep them in the hospital for 14 days. So if we do have admissions, that's just someone that was already there coming back.
Thank you. Any questions here now? And before we go on here, we've got Scott here yet still. I just encourage all you to get a tour either with Scott or Carmen. And, you know, we've got a multi-million-dollar facility and business here. And we're the overseers. We don't run it, but we're the overseers. So it's important that we have a really good picture of it. And I plan on going along too, because I've never had a full tour, Scott. I want to see all the guts. Yeah. Okay. Thank you very much. So are we on to,
Could I say one thing?
Yep.
Supervisor Wetzel, I used to be a CNA when this place was a CNA place. So I can totally relate to what you're talking about. It wasn't the COVID situation, but and everything they had, we did pretty well most of the time, once or, here and there. But like you said, if they found us doing really well, they would invent something. They really would. And then it'd take a little time to do that. But yeah, I remember those days.
so we're on to number 6.
Is this me?
Hmm.
Okay, good morning, everybody. I'm working from home again today. So thank you for that flexibility. The vouchers. Does anybody have questions on the vouchers today?
Any questions on all those? My favorite, which I mentioned before, but we've got new people now, is Bimbo Bakeries. What a name.
I looked at some bread.
Bimbo Bakeries.
I looked at some bread at the grocery store, and I think it was a Sara Lee product, maybe, and it said packaged by Bimbo Bakeries. So they're actually pretty big, I guess. Yeah, that is a funny one. When you look through the vouchers, and this is also for the newer members, what I look for is to make sure that these categories of the cost element name, like LPN pool staff, and make sure they fit within the categories, that there's no miscoding, is what I try to look at as well when I look through these. So if you find anything, it takes many eyes to make it all perfect. So let me know whenever you have a question on those, please. Okay. Moving along in your packet, the pool staff report is January through April. The total amount spent is at the bottom right-hand side, $972,913 year to date, which is about half of what we did last year altogether. I haven't compared the hours to see if we're using more hours or if it's just costing us more per hour. We'll be reviewing that as we do our budgeting for 2023, which for us is as staff, that is this month that we're working on budgeting for the next year, mapping that together. Any questions on that pool staff report?
You kind of answered it as far as the amount. We've got through 4 months now and we're already halfway through as far as the amount of money. But that could be just the higher costs that we have to pay now.
Yeah, I would say it's without looking at the specific numbers, which we will be doing shortly. We have our nursing budget meeting next week. But without even looking at them, I would say it's probably a combination of both. The cost is higher, but I do think we have had more as well.
Thank you.
Okay.
Mr. Chair,
Yeah, Supervisor Breslin.
when do you expect having to come to ask for an increase? Because I see this lasting, the pool staff fund lasting to maybe August.
So when it comes to asking for an increase, this is not a, this is a line, the pool staff is a line item number. So it would be once the nursing overall budget goes over.
Okay.
So, and it's a little bit, this is pulled out of the nursing budget. So these aren't also comparing apples to apples because this is their overall cost. It's not the difference in cost. So hiring our own staff would cost some of this money because it's also, then we're not paying our own staff for that dollar. So this is a little hard to pull out that exact number because this is just a line item of part of a cost center, if that makes sense.
Yeah, that does.
Mhm.
You don't see us having the ability to hire as many. The labor market is still going to
Mhm.
remain tight.
Correct. Yeah. So what, at this point, because we budgeted higher for higher census because previously the directive of basically the overall county was to act as though COVID was not a thing, because if it all of a sudden stopped at the beginning, because we're budgeting 6 months before the year starts. So if say COVID slowed down, things started to go back to normal. Obviously that hasn't occurred. But so we budgeted at what census would be if COVID wasn't a thing, so much higher than what we're operating at. So it's only if we go over that dollar amount that we'd have to request more money. So even if it's not looking great on the bottom line, if it's not over the dollar amount in the budget, that's when we'd have to do a budget adjustment. Because it's basically how much money is listed under that item in SAP. So if that makes sense, it's a little bit confusing. So that's why we keep doing the reports, is to give the amounts and where we're actually at. But the budget adjustment stuff, like we did last night for taking in more money versus getting spending more money, would only be if we cap out of what was budgeted, if that
All right.
works.
I just wanted to make sure we had enough for you to continue on. So,
Yeah, if we get to that point, we would do the full process, basically the same thing we did for taking in money. It would come to this committee first, then it would go to exec and then county board.
Okay. All right. Thank you.
That's interesting. I don't think that question has been asked since I've been on this committee. You keep doing that. I love that. No, that's great. I hadn't even thought of it.
Yep, those are great questions. And also as far as the budgeting, technically, we don't need to go for a budget adjustment from the county board unless we've expended or expecting to expend more than our total budget. So the total NDC budget expense of, I don't have it in front of me, but that total amount, even if it's between nursing and say administration or dietary, internally, those departments have caps on what they can spend, and we can like reallocate between those departments. But the county board has still allowed us to spend X dollars from the levy. So unless we go over that total amount, we wouldn't need to go back to the county board. Yep. Okay, so are we done with the pool staff numbers then?
I think so.
Okay. The next item would be this campus census, which Carmen has explained a little bit as well. And we're down in all categories, of course, because it's COVID, but boy, there's been a lot of activity. So we're, good on the Medicare days in May. I think we're really doing well. East and West have had more Medicare days now, which is good for our bottom line. So May should look a little better, but still behind because the 2 units were closed. So there we go. And next is the income statement. And today I'd like to go over the actual year-to-dates versus budgeted year-to-dates. Maybe concentrate on those so we can carry those all the way down. And starting with the revenues, if you look at the actual year-to-date, we've got 4,170,000. We had budgeted 4,900,000. So we are behind in our revenue by $731,000. And that's expected because of the 2 units that were closed. Senior meals, we go up a couple lines. Senior meals is still doing well. They're a little ahead of budget as far as our revenue, 52,000 versus 50,000. So that's been a good steady revenue stream. Bistro isn't open, but we had to budget for that regardless. Going up above to supplemental payments. This is an estimate. We don't know what the state is going to give us for supplemental payments. This amount is for county homes that have, we've already been paid our Medicaid dollars, and per bed, off of the cost reports that we send in, they're kind of like tax forms. We tell them how much it costs and how much we've received and what the gap is. That supplemental payment helps with that gap. But because of the new way of calculating Medicaid rates starting in 2022, and also with the COVID dollars that have come in, they haven't told us what we might expect for supplemental payments this year and how they're basing those, or if they're going to use the COVID dollars to offset our losses, which would mean we don't have losses, which means we don't get supplemental income. I haven't heard anything. Coming up next month is there's some state meetings, which the state will talk about that a little bit more, but I will keep you posted. I can't imagine them just yanking that money without a big to-do. So we are every month accruing some income there. So we're posting income, but it really hasn't come in. So that's an accrual. And then above that is the actual room revenues and therapy revenues. Any question on the revenues right now? Okay. On the year-to-date expenses versus budgeted expenses, administration is doing well, which is a good sign because those numbers don't go up and down with census. Those are pretty much the overhead costs of staff and some other fixed costs. So we're doing really well there. Although we will have expenses in July, I think, for our matrix system that'll post. So there's some costs coming up there. Nursing services is down by $400,000, which is good, but compared to the census, it's still a high number per resident day because of the cost of nursing. MDS numbers are a little over because some of our MDS staff are actually putting nursing hours in on the floor. And so that gets combined in the end. Pharmacy is high just because we've taken some people that maybe have had some high needs for Medicare dollars. That's pretty much where that comes in. And the Medicare dollars will offset that. Labs are good. Oxygen, we haven't used a lot of that money. Radiologies, the x-rays for basically Medicare people. These costs are recoupable under Medicare. We don't generally spend money on radiology or oxygen for people who are on long-term stays. Social services, we are still down one social worker. So we've budgeted for 3 and we have 2 right now. And at some point, Carmen will ask to get that refilled if it fills up, and look at that. But just knowing that we are saving money there dramatically. Life enhancement is good. Dietary is under budget because that's really directly involved with the census. I did some math yesterday with our budgeting and looked at the numbers of cost per day of our dietary department. The food cost per day is dramatically up, more than $1 a day per person for food cost. So we're looking to, I'm thinking, increase the budget for that next year due to COVID. Just so we know, the food cost is still high per person. Purchasing is good. Medical records is just staff. Property ownership and use is way off because of that depreciation number. We haven't posted the depreciation, so I pull it out and put it at the very bottom, the $227,000 mark. So that means we're pretty much right where we want to be there. Senior meals expense is lower than our budget, and our revenue is higher than the budget from up above. So that's a good thing. Our pricing is good on that then. Operations and maintenance is right in line. Housekeeping, laundry, linen, and then we have the therapies, which goes hand in hand with Medicare days and then some Medicare B therapies. Now, to speak back to the budget issue and how we go over without needing a budget adjustment from the county board, you see that the occupational therapy is over budget. So we manually push those through in our computer system because I keep an eye on what's the total amount spent. And between buildings, we budgeted down to the detail. So we watch that because the bills don't go through unless we push them through because they're over that budgeted amount. So it helps us, the computer system helps us to monitor these to another level. So that that's a safety in place. So in the end, our total expenses are 4 million and our budgeted was 4.9. So it shows an income instead of a loss. And then we add depreciation in there and we have a loss of $131,000 through April. Any questions on the financials?
That was a good idea to go through that. Any questions? Supervisor Bjork?
Yes, thanks, Mr. Chair. One of the committees I work on is the senior nutrition. And, you know, often they talk about the quality of meals and how good they are and everything like that, but dollars and cents wise, just so that I have an understanding of seeing what I see here, the more senior meals you have, the better it is for the neighbors.
Correct.
Yeah, and the numbers keep going up. As far as number of meals served, it's increased with COVID. So with any production, you know, you get more efficient the more you produce. And on your side of the ADRC piece, those people are paying for some of those meals and through donations, and so you're recouping some of that money, probably most of it, I'm not sure. But yep, we're more efficient. And then salaries do get thrown into that a little bit. We some of our dietary salary gets posted to the meals as well.
So when we work with the ADRC to set that price, we have a very marginal margin of profit off of it, very, very small. And we set that at what we were projecting to make just based on for number of meals based on past, and it has just continually gone up and up and up for the number of meals we're making. So our margin goes up slightly because of the staff time that is put into it. Because the most expensive staff time that's put into it is our registered dietitian, who builds the meals and makes sure that we meet the ADRC's standards for the meals. They are very, very specific, the state standards for Meals on Wheels for amount of protein, carbs, fat, all the different things in it have to be a very specific standard. So her hours are the biggest chunk of that salary hours that go in there. And they don't increase based on numbers of meals because hers is the building of the menu. So then it makes our margin go up more if we have more meals made.
Chair.
Go ahead.
Well, I'm encouraging you to continue to have it be a moneymaker for the neighbors, and that I guess another thing, I mean, I don't know until I landed on these two committees, and I mean, I don't know what the general public's knowledge is of it, but often the neighbors are, I don't know, maybe other people can see the wide range of public thing, it's a big deal that the neighbors are involved in getting meals to Colfax and Sand Creek and Meals on Wheels and up to the nursing homes. And I don't know, does the neighbors get credit for doing that? It never connected to me before that one program like the Meals on Wheels is really all starts at the neighbors in a very positive way. So,
And we try to keep our prices reasonable because ADRC could contract with anybody, technically, and we've got a good relationship with them. So I think it works out really well, and the transportation seems to work, and I haven't heard of any glitches in our system or complaints. So I think the system is working, and the neighbors really is part of the bigger community. Right.
And that's what you're saying, isn't it? That's a nice summary, Jane.
100%, 100%. It's part of the greater community.
Mr. Chairman?
Yes, Supervisor Keeter, and I'm only saying your name so that the public can
Yeah.
hear what's going on.
I knew that the neighbors did Meals on Wheels for Menominee, but do they go way out in all over the county?
So yes, we are the Dunn County provider of it. There are a couple other places. I believe there's a couple of bars in Nap, I want to say, that do their own for certain things. But so the food does come, we make it all at the neighbors, and then ADRC staff come and pick it up and they deliver it out to the greater community. So I'm not sure the full reach of it. I believe there's a time limit on how long the food can be in
That's what I was
a
wondering.
vehicle.
Yeah.
I believe it was something like 45 minutes or to an hour it can be in the vehicle, which isn't just travel time, because it would be the stop at the couple places here in town and then further out. But I do think it is much further than just Menominee.
Oh, yeah. See that? I don't think people are aware of, at least I wasn't anyway.
I can bring next month, I can bring more information about senior meals too, and have a full list of all the locations that we delivered to for like the main meal sites. Obviously, we wouldn't have a list of the houses that would get delivered, but there are main meal sites where people go and pick up their food. And I know those reach outside of Menominee.
Yeah, that would be nice. Doesn't have to be real detailed, just Colfax and so forth. Yeah.
Sure.
Jane?
Okay, any other questions on the financials or the programs? Okay.
Jane, I have one question. When you send us the packet, for example, we just got done looking at the total campus financials. And after that, you always have a per resident day analysis.
Mhm.
The one right after that, is it just missing the labels on the left side? And other managed care, Medicaid?
Yes, yes.
Okay, it's the same thing. Okay.
Yep. Yep. So those total days, yep, are,
Yeah. And maybe next time or each time, like today you took and you went through the financial report there, and perhaps next time, maybe we can just go through another part like that and just so that we can understand it better. But not necessarily today.
and then a question, if, does the board want to see the detail for the individual buildings as well? It's always in the packet, but we never review it. But it is part of how we get to that cover page. So think about
Yes,
that.
I think
If
the
you
answer
wanna-
is yes.
You want to keep it, but it's okay to not review in detail each.
Wait, now I misunderstood. Supervisor Breslin,
I'd
Well-
like to have it, in the packet, just so we can review it, but we don't have to go over detail of it. We
Okay,
can read these and see how it aggregates to the cover sheet.
okay. So what we're doing is good.
Yeah.
Okay,
yeah, sounds good.
then the last report would be the aging report. And I have snippets of our subsidiary ledger that shows that facility east, west, and central for each month. So the top is February, and then March, and then April. And the outstanding balance is, it was 1,000,001, and then 1,000,001, a little bit lower, and now it's 1,000,002. Some of that variance does come in to play when Medicare, we get some big Medicare payments either at the very end of the month or the beginning of the next month. So some things were slower to pay this past month. And our volume is up a little bit as well with more people in-house. As we look at the very end number, at the bottom right of the page, the 165,000 is the really old debt, and that continues to go down with payment plans and old things getting resolved. So that's the positive news.
We also have had an increase in VA, which we've discussed before is one of the slower payers, but they always do pay us. So that one sometimes they're one of our better payers, both for dollar amount and we always get it. It's just sometimes a little bit slower. So that sometimes increases aging, and we have quite a bit of VA right now.
Yeah, so that's the good news. Our staff is stable. We're not having any turnover, so that means the billings are pretty much on schedule. We've had some illness and some people out sick, so I would imagine next month it would be higher, the aging, because our billing is about a week delayed for the Medicare, which means the payment won't come in again for next month. But otherwise, that's good. What I'm doing is meeting with each department of Carmen's with Carmen, and we're going through each financial report to date and per last year, and looking at what we might expect for next year. And Scott said that, we've met with him, and our budgets are due to finance June 3rd. So this is our crunch month to get our basic budgets together so that it can be reviewed by the CFO, Beata, and others. And then we'll rework things and keep working on them until October, November, when you pass the budget. So that's what finance is up to these days.
Any questions or comments? Finance has been up to more than that, I think, but you're pretty busy.
We had a good training yesterday. Beata had a group meeting and we watched the video, All the Queen's Horses. If you haven't seen it, it's about fraud, municipal fraud. How a lady had siphoned off 55 million over 20 years from a community of about 16,000 people. I believe it's in Netflix. We found it in Amazon, but All the Queen's Horses. It talks about what the purpose of auditing is, what the auditors can find, what they aren't expected to find. I think it offers a good perspective for the board's side and for staff side as far as fraud.
And Sean, you heard about that?
Yeah, I watched it a couple weeks ago. It's very interesting.
Oh, okay.
It did say the purpose of auditing is not to find fraud. So we need more internal controls and we're working on that. Our department is I think very well documented. We need procedures in place. But since I've been here, the finance department is now balancing out the trust account funds where it had been over at NDC, and the social workers were doing that balancing. But now finance, we're staffed up, so we are able to take that back and divide duties. So I think we're in good shape as far as what we do to prevent fraud.
Well, thank you very much, Jane.
You're welcome.
Okay, then I guess we reviewed this. We're on 6A. I will accept the motion, take a motion to accept the review of the vouchers and financial reports. Supervisor Bjork and I think Supervisor Keeter was quick with the hand. Any other comments, questions? All in favor? Aye. Opposed? Okay. Thank you. We approved it. Now, at the request of the chairman, future meeting date and time discussion. Carmen, congratulations, Carmen. Tell us a little bit about why we need to change our dates.
Sure. So recently I attended the Leading Age Annual Conference and Business Meeting. We have 2 of those a year, but the one in the spring is when we have the actual business meeting for it. And I was elected to the Leading Age Wisconsin board. And subsequently found out that the board meetings are on the 3rd Thursday of the month, which is the day of this meeting. And a lot of those are in person in Madison. So I will be out of town on the day of this meeting after we just said it this last time. So I asked Chairman Kinnear to include this on the agenda for this month, as next month is the first meeting that I'll need to be in person to attend that meeting on the time that this meeting would normally be scheduled. So to look at a different time for this meeting to be scheduled, if it's the same time the following week, I don't know if that would work, or going the week before would make it very tight to get financials. So I don't know if a different day of the week or maybe the following week, the 4th week of the month would work too. I'm not sure.
Well, congratulations.
Thank you.
That's just what we need. People know how good you are.
Well, thank you.
All right. Any thoughts? Sean, you're working, so.
I'm pretty much open. My employer is very flexible.
Don?
You have the county calendar or what?
Well, I do know that on the
can
4th,
pull it up.
the 4th Thursday admin meets. Anybody here on admin? The 4th Monday, J&L meets. The 4th Thursday, Health and Human Services meets, but they're all in the afternoon. Are you on Health and Human Services, Larry?
I used to,
Okay,
I graduated.
okay.
Yeah, there's a-
Yeah, I remember we used to push them through. you know. I'm sorry, Larry.
Let's just say going through the vouchers here compared to Health and Human Services is a real pleasure.
So yeah, the Committee on Administration's at 3 p.m. on that Thursday, and Health and Human Services is at 6 p.m. that Thursday.
You want to go 4th Thursday at 9 a.m. then?
That'd be great.
Sure, that'll work.
Good.
Okay.
4th Thursday at 9 a.m. and that will be in June. And Larry, you might be chairing that one. I
Well-
might not be here. So
It'll be
we'll-
the 30th.
I won't be here. Unless something
Will I
odd
be
happens.
No, it'll be
23rd.
the 23rd.
Yep.
Then it's iffy. Okay, so anyway, so we have the fourth Thursday of each month from here on out at 9 a.m. And the next one would be June 23rd. Is that what you said, Carmen?
Yep, 23rd.
And
During June dairy month.
good.
Okay.
And I.
Just wanted to get it on the record.
Yeah, well, you did last night too. That's good to remind us all. I'm looking forward to that. Any other questions, comments, announcements that we need to have, even though it's not listed as an agenda item? No? Then we are adjourned.
Thank you.
Thank you.
Thank you, everybody.